been disseminated among all the students uniformly, or the best of the information has been given to all the students, because one group may be very active and intelligent, one more group may be not that active. So how do we maintain the standard is that
in each group discussion, we need to give them their feedback. We need to tell the student what were the things that were lacking in that discussion, where they can improve on. So this feedback has to be given immediately, once that discussion, during that discussion.
Yeah, but content cannot be changed or cannot be improvised.
It will improve.
You are right, sir. You see, we have every small group discussion, we have something called rubric, and for that every content we can score it. So every content of discussion, every seminar, whatever it is, for each one we have rubrics for that one. Like we can score it. That way you can maintain the standards, as you said. So that is one thing, and the reflection we give, the facilitator gives the reflection. That is one thing.
Next time it can be improved, but same, that's a loss, no sir.
It's a loss. Lesson plan. When we do this session, we need to have a lesson plan. So if there are 5 facilitators, each will follow the same lesson plan. So even these discussions follow a plan. When we do any of these things, there is a particular plan the way we do it. If you are doing a jigsaw, what she does as a jigsaw and what I do for the topic will be same. The
Standardization or
yes. So standardization comes from lesson plan. I think the next talk will be on lesson plan. Yeah. So lesson plan is for both large group as well as for small group teaching. More important in small group teaching to maintain the standardization. LGT, one person will take a lecture, whereas SGT will require multiple facilitators. Same teacher cannot take for all the 3 or 4 groups. So maybe one lead faculty, the plan which is prepared will be delivered by multiple people.
Uniformity is the issue.
There is a challenge to maintain uniformity, but standardization, I am going to cover these objectives. This is my blueprint. Okay, so that can be possible. We know these are the objectives. This is the way we are going to deal. This is the SGT technique. This is how we assess it. There will be difference in the facilitator skills, but content will more or less be the same.
Yeah, we have for small group discussion, we have a lesson plan like this. Each competency, lesson assessment, everything is already written. This is the lesson for a small group discussion. So everything is written. We follow this format. We have to follow that one. We have the standardization.
Difference in the delivery, sir. 5
Of course, we have teachers.
Entire class will not get the uniform content or
No,
the
they
uniform.
don't need to. When you are talking of SGT topic, it is more of what students are contributing. So this group, 30 people are different from some other college participants, but the content being delivered is almost the same. The way you are interacting may be different from some other 30 participants, but everybody will get the uniform content. Okay. The skill of the facilitator is what is the biggest challenge. If you have a facilitator who can get more interaction, maybe your level of learning will be a little more. If you have a facilitator who is taking it more like a lecture, the level of learning changes. But overall, the delivery of the content will not change so much. Also, what happens when, even in CBME, you have, let us say, 70 hours of SGT, right? So different topics will be delivered by different facilitators. So overall, the student will get a good idea of the skills which are needed. SGT is never only about the content. It's about the other skills which we learn, such as team building, team dynamics, presentation skills. So SGT, that's the whole thing which makes it different from a large group teaching. So those skills, as a group is exposed to different facilitators, they will get exposed to that. The rubric what sir is talking about assesses those skills. So that's why we usually have same group of people, batch A, B, C, D like that, with multiple exposures to different level of teachers.
The groups need to be same.
It depends. For example, when they come to, let us say when they are in phase 1. So anatomy may have one set of groups, physiology may have the same or change the groups. When they go to the next phase, again the groups will be reshuffled.
No, I thought for different classes we can't.
You can. It depends. Like for example, if we are teaching one topic, I would prefer to have these groups. The next teacher says, no, I would like to change the groups. But in general, to make sure all the 150 students are divided, we prefer to have broader groups as same. Normally, most colleges split it into 3, 50 each, and then 50 each department will supplement. Faculty shortage is there everywhere. So you know nobody can do the actual 30 students. Very difficult to manage. We don't have students. 30 is the ideal number, but then feasibility is a bit difficult.
On the topic, one class of major teachers.
So this is clear now. So these are some of the other interactions in small group discussion, that is demonstrations. For everything we cannot have this peer group of facilitator, student interaction. Some of things have to be demonstrated. Then the tutorials, when there are some students who do not understand the concept, then you give them this personal attention. It is a two-way communication. Role play, when you need to manipulate their attitudes or behavioral change, then you have this role play. And seminars, when there is an in-depth study of certain topics that you want in the presence of an expert, that is the staff who knows about this topic. So this is about the small group discussions. These are other innovative methods which Dr. Padmini has already covered. This is Mentimeter, Kahoot, Socrates, Google Slides, Google Forms. Now Mentimeter is something where you can develop quizzes. You can have the feedback of your class online. Again, Kahoot is also where you can develop these quizzes, or some of the trivia can be developed on these things. So these are very good if you're tech savvy and you can handle all these, then you can definitely start with this. So this Kahoot is actually used in one of the study and they had a very good result with this. Again, it needs to be feasible for the whole class, what kind of a quiz you're going to develop. And I just try to log in and do some of these quizzes. Formulating this quiz is also a task for people like us. So we need good IT support for all of these things. This is from Socrates, where you can present grade, then live polling question and answer for teams. These are the free alternatives, Quizlet, Geopard, the Rightful Me. Rightful Me is the one which is commonly used. Again, it's only the quiz and the trivia that can be developed on these apps. ChatGPT, so much is being told, and there's already an article or a news line whether the tutors or the trainers will be replaced with this ChatGPT. I'm not very sure about it. Yeah, it's like a modified version of Google, very good chat message. It's like personalized information. But whether it will replace us, that is yet to be seen. Whether we'll be banning it, that is again the decision that
Many universities are banned for assignments.
yes, and some universities are actually promoting this for an interactive teaching. So with this, I thank you all for your patient listening.
Just named it, madam. Regarding that.
Madam,
So that's-
I have one question, Rashmi madam. See, CBME, they promote e-learning, technology enabled, yes, but the infrastructure should be supportive. For example, we are talking about about YouTube. YouTube is blocked. When we try to use the internet within the college, it's blocked. Our WhatsApp is blocked. Our Wi-Fi
Mobile
blocks
phone only not
everything.
able.
Yeah, even good journals we are not able to access. Okay, why not? It is a part of it. The college should have Wi-Fi enabled.
So ideally now, if you see
That
the
also should be
NMC
the norm.
guidelines, the NMC guidelines do require material to be available to the students in the library, in the e-learning centers, and also Wi-Fi access. In fact, our own Aadhaar, so it is a requirement from NMC, but then left to the institutions and the management. We are all aware of the logistics.
Yeah, that's part of, that should be part of CBA. I mean, curriculum
It
mandate is there.
is the minimum requirement for college to apply for seats, in that it is mentioned.
Yes.
So we do have to have it. In fact, all the boards are now supposed to be interactive boards, smart boards. So it is supposed to be there.
Madam showed her tab she can write, but
Yeah.
I can't buy that 50,000 tab just for taking the lecture.
Yeah, that's why
If college provides
we
some
also
of
spoke about the things which are available on your laptop, the normal laptop, or chalk and board, or even the flip chart and these which are there. So this is one end of technology. Even these days, no harm in it.
Yeah.
But as for smart and the interactive board comes, this is available in all lectures.
Yeah. Even small things are sometimes get blocked. like YouTube will get blocked.
I know, sir. All of us have the same issues. You know, she spoke about all of these things, prop and all. They require a mobile. So COVID time we allowed mobile. Now if I want to go and do that, I may allow in my class, but the next teacher may say, how dare you get a mobile? So it depends. I am okay having the mobiles. I in fact ask them to keep it on the table. So I know there's nothing happening down. And also I keep asking them things to search on mobile.
What is confusing? Sometimes we say don't carry mobile, don't carry electronic devices. We say one side. Students tend to use these devices in the class. And in other way, we tell that you use YouTube, you watch it on YouTube.
Balance, balance. And I think there's a session on self-directed learning. So a lot of these technology will find a place there. The ones which they do after 4:30. So a lot of these technologies are not meant for when you are here. They are meant for beyond the hours also. So it's a balance. We all need to strike a balance in whatever we do. So technology is also just like that, whether it's mobile use or use of these technology.
We still don't know whether AI will replace teachers or not.
We don't know. We don't
Yeah.
know.
But those who use AI will replace those who do not.
Exactly. So sir, you give perfect punchlines, you know.
Yeah, so just the last 5 minutes. Anybody wanted to share your experience with the where you have done in a small group or large group, how you improvised or how you did some innovation and how you got the attention of the students? That's all. I can take some points from you. You can share your experience with the whatever small group you have done or whatever large group
Otherwise, they don't interact, they don't look particular things. So we give them a checklist, or we brief them what are things they have to look, and once they come back, they have to give the feedback. What are things they have noted down, and what are things they have discussed with the particular person. For example, if I take them to PHC, so PHC medical officer, what are things they have asked, and what are things they learned. So before taking them to the field only, we have to give them checklist. Then we get the feedback once they are back. And secondly, group discussion. Yes, we do focus group discussion many a times. Here we ask them to sit in a circle, and there are many people, many challenges Madam told. There are few people are too silent, few people they talk much. We name them as a talking terror, silent Sam. Like that in teaching and learning also they mention these things. And there will be doubting Thomas. Always few people have habit of asking doubts. Okay. So all these people we need to handle. For silent person, we ask them, do you have any questions, something like that. Person who talking terror, who talks much, so we ask them allow others to speak, like that. And other person is like a doubting Thomas, who has more doubt. We ask him, we discuss these questions later. Let other person should tell.
Focus group is of course for our qualitative methodology research, we use it. And then of course field visits of community medicine always enjoying. I think at least I enjoyed it basically. Yes.
You have not followed checklist, I think.
Not followed, sir, not followed. We just enjoyed the trip, that's all. Okay, I think we'll wind up. It's Rupa and Virupa for you. Thank you very much.
Activity now. Two of you share one sheet. It's about the teaching learning methods. We'll have to answer these.
So we have passed on a sheet with the different, just list out the different TL methods which was discussed. And yesterday we had shared one template where you had derived the SLOs, competencies. So there was one more column where you had the TL methods. So we request you to fill that also. So we give you 5 minutes. The other one yesterday which you filled, yeah. So just the TL method column to be filled. This from what all has been told, like whether it is a small group teaching or the DOA session or the lecture.
Demonstration comes in small. Demonstration class is simulation.
Yeah, some parts DOA session. Other things like problem-based learning, you can put it. Case-based learning. Yes. Second, each SL, which TL method will be used.
best. I think about DOAP, you are not aware? No, okay, it is demonstrate, observe, assist and perform. This is student will observe the demonstrator, assist and then perform. Okay, it is usually used for practicals or in clinics where they have to do it, any skill. So in the Miller's pyramid, if you see, it comes in the skilled one. So below it is knowledge, competency, higher up is skill, procedure. Okay?
This topic for students. One is manual, one more student is
One
First item, clinician wants a group of 10 students to know how to perform EJET. So this we can do either role play or demonstration.
Role play.
Like we call one of the students as a patient there.
So clinician is DOAP session, demonstration session.
Demonstration.
Demonstration, observe, perform.
Demonstration
We will see you demonstrating, they will assist you, and then you will
teaching equipment analysis.
Please listen here, please,
Teaching equipathogenesis and laboratory diagnosis of tuberculosis for a group of 100 students.
yeah, 100 students are there, since it's a large class, so it is lecturing. Anybody else? Chandrasekhar sir. Third one.
Batch of 60 interns in groups are to be taken hands-on training on CPR, so using simulation.
DOAP, demonstrate, observe, assist.
An audience of EMT family care clinicians have to be oriented regarding different aspects of AIDS, clinical features, epidemiology, lab diagnosis, and treatment. So this,
There are 50 clinicians, interactive lecturing. Interactive lectures. Because they already know about it, so it will be an interactive lecture.
Can we all listen to the others, please?
Anybody all the
Lecture of science.
simple ones. In-depth class on your vaccine.
Seminar.
Problem-based learning or case scenarios can be picked because it is in-depth.
Exactly, yes.
Problem-based learning will go much into the depth. You can go next one you want to practice? Or Pratima?
Group of 20.
20 students asked for ideas for creating AIDS awareness among the general public on World AIDS Day and overall
SGT also.
Street play.
Okay, okay.
They're saying brainstorm.
Role play or the street.
Role play, SGT. Role play is also next you want to continue? Janice wants to talk? Seventh one.
We just thought one thing parent shared, just.
Lecture on antibiotic therapy is in progress and the teacher wants to reinforce on prescription writing. Snowball.
Handouts. Give them papers and ask them to write.
this statement is
A lecture on antibiotic therapy is in progress and the teacher wants to reinforce on prescription writing.
questions during the
Pass the chapter at lecture, pass the chapter and tell each person what they are doing.
handouts to for what handouts
You give them papers, they have to write it and they submit it.
Project.
And they check it.
instant
Yeah.
get answer. What else?
Think, pair, and
Think,
share.
pair and share.
Think what, like, it's your result. Yeah. What is the question you want to think
because
about?
you
What
want
do you
them
want
to
to
learn.
pair and share?
No, we want them to learn prescription. So you give them a scenario and ask them to give a write a prescription for a particular disease.
Okay.
So then it is like 1 to 1. You know, one writes a prescription for the other and one writes for the other.
Okay, so each one writes a prescription, there is a peer evaluation.
Yeah.
I write a prescription, my next person evaluates.
Yes.
Okay, anything else? That's okay, acceptable, right? Because we have a big class. Something else? Exactly, that's why this can be done. Because the lecture class is going on, you have everybody seated, so I write something, you check it for me. So that's a very good way in a lecture class. Anything else?
No bowling.
bias will be less when compared to traditional methods. Now suppose if this was a first year MBBS student, anatomy paper, which one do you think would not be given? Can I ask what is the diagnosis for a first year MBBS graduate? Same question. First question, which structure is affected on right side? Instead of that, can I ask the diagnosis? No, diagnosis should not be asked in initial stages. Later for third year, fourth year, even this it is there. Second question it is not framed properly. So that should have been skipped. So initially the diagnosis should be given, only the other anatomical basis or whatever, it should be asked.
Clinical anatomy is relevant. Median or carpal tunnel. Clinical
No. Now what happens is, this is easy question. You can't ask differently. We won't teach everything in first year. Few important things we teach. So that becomes difficult for the diagnosing for the first year MBBS students. Later as they start posting, yeah, condition, that is fine. Yeah.
That's the diagnosis.
Which one?
This condition.
No, all the conditions. In median now it is okay. The other aspects.
Other aspects it is difficult for students.
Like that pleural effusion.
Because
So,
we are, since around 2-3 years we have started this, the students are experiencing, because the paper setters will be from different university. We don't know which applied anatomy they have taught in whatever the different ways. So when the paper comes, it will be difficult for the students to write the diagnosis. They will be knowing what is anatomical basis, everything they will be knowing, so that can be avoided with this.
And one note, this is the essay question, but the more questions are single response answer.
Yes.
Beauty of essay writing is not there.
Yeah, that is a disadvantage. Usually, generally for MD or MS, we give 10 marks, 10 questions. So you can take your own time, write, go in depth. You can. It all depends on your writing condition. So this is the advantage if you have essay type questions. But the problem is with the essay type or traditional type is, two examiners may not give the same marks. So it differs. One person will be giving, out of 100 he may give 60, the other person may give only 45. That is the problem. This is just like, yes, it is like mathematics. So other example will go. We'll see first the traditional essay question. Pediatrics. Write a note on ORS therapy, 10 marks. So structured essay of the same will be this. A 1-year-old child is brought to the casualty with diarrhea for 1 day. He has vomiting. On examination, he weighed about 9 kgs and had evidence of moderate dehydration. You decide to provide oral rehydration. Question number 1. What is the estimated fluid deficit in this child? B. Calculate the amount of ORS required for rehydrating this child. C. List 6 parameters that you would monitor during rehydration therapy. D. Using a diagram, demonstrate the principle of action of ORS. So this is the traditional one and the structured essay type.
Timing is also done. Time duration for the answer?
No. Time is not. Total 3 hours.
1 minute, 8 minutes, 3 minutes.
No, time you can skip. Time is not the issue. Similarly, short essays. So it can also be framed in a similar manner. Long question 10 marks, these are 5 marks. A 70-year-old lady sustained a fall in the bathroom. After falling, she was unable to get up. On examination, she was unable to move her left lower limb, which was seen to be laterally rotated. An X-ray of hip joint showed fracture of neck of femur. Question. Explain the anatomical basis of lateral rotation of lower limb. What is Shenton's line? How it is useful for interpreting the radiograph, C. Possible complication in this patient is avascular necrosis of head of femur. Explain the anatomical basis of this condition. So diagnosis is given, we are asking just the anatomical basis. Because in this condition, he will be knowing what it is, but he may not be able to write as diagnosis, first year MBBS. So even short essay carrying 5 marks can be structured in this way. So we'll see what are the guidelines for framing a good essay question. So just avoid these. What do you think? Questions which start these. What is your opinion? Discuss. Instead of these, you can use enlist, enumerate, define, compare and contrast, state the reason. So these are the guidelines for framing a good essay questions. Come to conclusion. Essays are excellent tool to access higher cognitive learning like analysis, synthesis and solving complex problems. The same shall be improved rather than totally abandoning in favor of multiple choice questions. This group activity.
We'll do the group activity after lunch.
Thank you.
Okay, if I can go ahead. He has talked about long answer questions and the short answer questions. Please decide among yourselves who is the team leader now. Let's begin with short answer questions. So you will have to understand how to structure, what are the advantages, what are the disadvantages, or how to design good SAQs and marking rubrics. What do you people know about short answer questions? I am sure everybody have used in your department. What is the best short answer questions that you have asked? Okay, name 3 causes. Okay, anybody else?
3 adverse effects.
3 adverse effects. Okay, you have done it. Very good. That is the usual way, but there are other methods also. So what can be the other methods? One may simply ask the student to write missing word of the phrase. The current Prime Minister of India is dash. This can also be a short answer questions. If you really want objectivity in your answers, or list, as you told me just now, list the 3 types of plastic surgery procedures, etc. Or for 1 sentence answer, what is the basic principles of gram staining? You can ask these type of questions also. So, short answer questions are open-ended questions where the students are required to create an answer. They commonly are used in examinations to assess the basic knowledge. Now I want somebody to start telling me the advantages. One group will tell advantages, one group will tell disadvantages of short answer questions. Oh, I'm sorry. Yes. Advantages, anybody? 1 minute. Answer. Okay, one student answers to the point. Anybody else? Uniform evaluation. Uniform evaluation. Same thing. Almost the same thing. Scoring. Okay. Can you ask?
If you know the answer. If you don't know the answer, scoring is better in not.
Okay, so you are telling it's a disadvantage or advantage? Advantage for us. Okay, fine. Is there anything else? The most important thing is objectivity. There will be objectivity in questions. Anything else? Wide coverage of, very good, very important. Wide coverage of topics. That is an important question, advantage of short answer questions. So they are easy to set. Yes, they are easy to set. It is relatively fast to mark. Second important, I wanted to give chocolate to whoever tells me this at least. Better content coverage, I think Chandrasekhar has told. And most importantly, there is improved objectivity. Now, what Veena madam was telling, higher chance of assessment of clinical reasoning. I am actually not sure whether short answer questions are better for clinical reasoning. You need to structure the questions properly for short answer questions for clinical reasoning. That you might have to use some other methods in the according to the domains. They can be used as a part of formative assessment, as the structure of FAQs are similar to examination questions. Students are more familiar with practice and feel less anxious. As he was telling just in the beginning, students are worried only about which question? The long question. They are actually not worried about the short questions. Many times I have seen the question answer paper starts with the short questions. They feel better to write short questions. And there is no guessing here. You cannot use guessing again. I don't know whether to call it an advantage or a disadvantage.
It's an advantage for a person who has read very well.
Ah.
It's a disadvantage
Or
for
who
a
has
person who
not
has
read.
an overall idea about it but not a specific answer.
Okay. Yes? Okay, now next, yes, come on. Disadvantages, somebody has not told me disadvantages. Where is it? SAQs are only suitable questions that can be answered with short responses. So it has to be a short response. That has been taken care by your university. How? For 5 marks question they have given only how many pages? Yes? 3 pages I think so. 1 page for 1 page I think so. Therefore 3 marks. 3 markers, 1 page. And 5 markers, 3 pages.
Yeah.
So that has been taken care by that. At least in that way. It has helped teachers. It has helped evaluators. Assessors, sorry. There can be difficulty in grading if questions is not worded carefully. Can you give me an example? Difficulties in grading if the question is not worded carefully.
So that can apply even to long questions.
Yeah, yeah.
That can apply even to
Long questions also, agree. That's why
ambiguous questions.
That's why long questions the marks has to be given 1 plus 2 plus 3 plus so that you are actually giving the number of marks. If assessors wish SAQs to assess deeper learning, careful attention on appropriate questions are required. So as we just now discussed, deeper learning, clinical reasoning, I think short answer questions may not be the suitable assessment tool. Also, if large amount of knowledge needs to be tested, it is more efficient to use MCQs. We will be going to MCQs later. As accuracy of assessment may be influenced by handwriting or spelling mistakes. There can be time management issues like SAQs are not easy to complete or score as MCQs or true or false questions. We are going into that now. Okay, how to design short answer questions. I hope all of you have understood what are the advantages and what are the disadvantages of short answer questions. Can I get a feeling who likes long questions compared to short questions? Among here. Just raise your hand. Who are for long questions? Anything? For corrections or for answers? Custodian. He's a custodian, yes. Short answers. Who likes short answers? Everybody likes short answers. Who likes MCQs? Everybody is for MCQs. Okay. Who will design MCQs? Who is going to design MCQs? Kishan, I think he might argue that design MCQs. So, okay. Yes. How to design a good short answer question? Design short answer items which are appropriate assessment of the learning objectives. Make sure the content of SAQs measures knowledge appropriate to the desired learning goal. Make questions clear and easy to understand with wordings and language appropriate to the student population. So language is very important. The verbs what we have been talking yesterday and today, you need to use those verbs very carefully. Set the questions explicitly and precisely with clear instructions to test the desired knowledge and get the specific response. Can I go into some questions now? Yes, this is better. How many have used this? Family planning methods most appropriate for adolescents? ABC. You can use this as an assessment of learning. After the end of your class, you can keep this as a question and ask students, because you would have taken a class on this, you ask them what are the methods. So they actually know this has been taken in today's class. Next, neurocysticercosis is caused by dash. So you are giving one dash or you are giving 2-3 dashes. That is, I think we all have gone through this problem earlier, I think so. So if you give 2-3 dashes, the student is confused. Now, how many answers to give them? It is caused by one worm or 2-3 worms, what to write. You need to be careful in designing such type of short answer questions. Next example, in the year dash, Canada turned 100 years old. Or, which is better, Canada turned 100 years old in the year dash. I don't know, I leave it to you. But I think it is better to put your dash at the end of the question. If a room measures 7 meters by 4 meters, the perimeter is dash. What is missing in the upper one? Yes, exactly. I have written it here, the units. You have to mention the units. You will have to be careful while designing such type of questions. Do not use too many blanks. I have told you like this. This will be very difficult. This can be totally subjective answer. Which Prime Minister, where, when, how, God only knows, you need to be careful. But it depends, if you are talking on that subject and the students know that they have to answer about that question, then okay, but still this type of questions have to be avoided. Direct questions are better than those which require completing the sentences. I am going to the better one. In what battle fought in 1815 did Wellington defeat Napoleon? Or in what year did Wellington defeat Napoleon at Waterloo? At least you are giving them specific objective questions. Wellington defeated Napoleon because he has had 3 wars with Wellington. So now you can't actually know what is going to happen in the answers. You need to be careful while designing such questions. I know that you have been using short answer questions in your question papers, but I don't think you have been using like this. In this way you would have not been using, I think so. So then you need rubrics. Can I go into the rubrics? These are the rubrics. So why rubrics? Most importantly, you need to keep it objective. You have to prepare it in such a way that it is completely objective. 4, answer all the points. 75% you are given 3 marks, 50% 2 points, and like that.
But 0, all the points answered also 0?
Which one, sir?
0%.
0% means you are not. 4 is total marks. If he has answered all the points, give him 4 marks. If he has not answered anything, 4, you can make it 3. I mean, this is a rubric, this is just a pattern, however you want it. You make it, that is left to you. That is your departmental, how you want it. Yes, percentage, exactly. The objective here is, if you are having short answer questions, you make a rubric. If you are having long answer questions, you will have to have the question mark, how sir has told 1 plus 2 plus, you better keep it like that, so that it becomes easy, but at disadvantage, I agree with you, they are not going to write, their reasoning skills are not being understood. So, you can ask like this, where you are given marks for these points. This is long question. If there are 6 possible arguments to a question and the student scores all 6 arguments, he will get full marks in that question. If he scores only 4 arguments, he will get a relative mark. But what is the other take on this? Can you just read this and some teachers will agree that if they have written, for example, enumerate 3 screening tests and 3 conformity tests for diagnosing HIV. Now, if they have written the diagnostic tests, the teacher will feel, give 4 out of 6 marks, you give 5 marks. Okay, no problem. But if he has written only screening tests and he has not written the diagnostic test, he has written only 1. Some teachers may tell, no, he should have written diagnostic test more. That's why I will give only 2 marks. So you need to be careful while designing such questions. I think it would have been better here. Clarity should be clear. Screening test separate, diagnostic test separate. That is, you may also decide to be lenient. If there are 6 arguments in the question and the student scores 4 out of 6, he will get full marks. Okay, agreed. Teachers, and that's left to you. This is about short answers.
The person who writes all the 6 correct. If you give marks for the person who has written 4, what about the person who has written all the 6? What are you going to give him? Extra marks? No. So you have to
Make your rubric very clear. No, that's what sometimes in pathology we give more importance to etiopathogenesis. Maybe in gynecology you give more importance to clinical features. So your rubric should be very clear. Clinical features, if you have written, give 3 marks in your subject. In my subject, if you have written etiopathogenesis more, I will give you more 3 marks. Let it make your rubric very clear.
So one more thing, what happens is, student has written 4 arguments out of 6.
This one, huh?
No, the previous.
In that, student has written 4 out of 6. And the most important 2 are not written. So strict teacher may feel, oh, it's not written, he may give 1 mark or 2 marks. So there is again subjectivity.
Agreed? See,
How to make it more objective.
The answer to all this is lesson plan, how like Madam has told. So when we are doing a lesson plan, we make it very clear what you have told just now. This is the most important thing. This has to be written in your answers. We will tell them in the assessment or in the teaching learning methods. We will tell them that this has to be explained properly. Then you can tell. Then you make your rubric and you say how you want to give the marks. I will not, nobody, that depends on the subject, how you want to give.
How can you change this question itself for it to be 6 marks? Endless lab test to diagnose enteric fever.
I'm telling you about the...
Because it's a 6-mark question.
Not that, previous question.
Okay, no, just...
Come to that only, because see it says 6 argument, let's imagine there are 6 tests here.
Okay. They have written 6.
So why can't I put up there only, list 6 lab diagnoses or 6 ways of diagnosing enteric fever based on blood investigations.
It will be more specific.
It will be more specific. If for example there are 3 ways which I expect from the student, if I put that number there, if I put 3 numbers and it will be for each test there will be 2 marks. So that leniency and subjectivity will go. We need to be very objective.
Objective. The main most important thing now is objectivity.
The previous question there, leniency. Actually, that would not be a very good way to put it. Because what will happen is, like she said, somebody writes 6 and 4. There's the distinction.
So if somebody has written 4, you give them full marks. Somebody has written 6. So what is the difference between the person who wrote 4 and 6? So you need to be at least 1 mark you have to cut. So that person who writes all 6 should get the full marks.
Should get full marks.
Yeah.
Also
Though you are lenient on whatever it is.
structuring the question that instead of saying full 6 marks, like you mentioned about etiopathogenesis and clinical features. Now for pathology, etiopathogenesis is more important. Give 4 marks to that. 4, 2. So if I have asked 2 things, it will be etiopathogenesis 4, clinical features 2. Now in
Gynecology.
clinical subject, if they feel etiopathogenesis is less or equal important, yeah.
Can do it. But what I meant was,
Leniency is not required.
leniency for 4, you can't afford to give full marks. That was my answer. Like, that was my answer.
That's where the answer key helps.
Answer.
The answer key is the.
Then we are not having with RGH.
No, it has to be.
That is not there with RGH. That is why it is becoming more subjective actually. Depends on the person.
Lesson plan.
Yeah, answer in terms of assessment,
Yeah.
it becomes rubrics or answer key. Lesson plan for teaching. For assessment, it's your rubrics and the answer keys which we see.
So, till now in pharmacology, all the short answers were mention 3 drugs belonging to a particular group and mention 3 uses, or mention 3 users and 3 adverse effects. Now they have changed all the 3 marks to rationale of using amoxicillin with clavulanic acid. Some people will write just clavulanic acid is a beta-lactamase inhibitor, so it's combined with amoxicillin. One more person will write amoxicillin gets destroyed by beta-lactamase produced by staphylococcus, clavulanic acid is a beta-lactamase inhibitor. So how do we differentiate?
The better thing here would be.
What's the question given here? Now when you are having these 2 answers, what's the question you had asked initially?
No ma'am, no what they have done in
No, I know the categorization. So the question is how did you phrase the question?
rationale of combining amoxicillin with, it's all
Can you
rationals.
rephrase the question? I know that whole category in pharmac belongs to the rationale of drug uses, right? Can we reframe? Can we use some other word here?
It's coming from
It's
RGH.
coming from RGH.
What is coming from RGH is what is given in NMC. They say this category of question should be talking about rationale. It should be talking about, little more descriptive part. That's a great. How else can it be phrased? I know there is one challenge here because you are not making your own papers and you are not a deemed university, you are under RGH. So you really don't have too much role in that. But as a teacher for internal assessment, how would you want it?
Give reason why amoxicillin is combined with clavulanic
Yes.
acid.
So or if you change the word to justify.
Justify.
Justify. Now in justify, you can explain justification means put both the point of views. This has lack of this is that, and hence I am combining them. So when I say justify, each statement has to be made and then.
Correct ma'am. But I'm asking now the university is asking such questions.
You
So for
have to-
valuation.
So your own places.
University has to give a key.
Yes.
See, when
That's
that
not
is
provided.
that rationale, this should, no, that is not provided. That is our.
No, I'll tell you, we can blame the university, but we are in new university. We also blame them saying our university paper comes from external. We can do that, we continue to do that. But at internal assessment level, it's left to us.
Correct.
Right?
I'm talking about many of the universities.
You don't need to worry only about that. See, changes are happening slowly. Even at all state level, there are board of studies there, which are members from your own colleges. Right? So slowly the change will happen there also. In fact, AJIMS is one of the universities which has given such a huge document about each SLO, all the things. No other deemed university has, not even state universities have. So AJIMS is actually way ahead of most colleges. Right? So I do understand that challenge what you are saying, but we look at the positive, we change what we can, wait for university to decide what they are doing.
Maybe over a period of time.
It will change.
3 years down the line, we will get that.
It will improve. That will. I agree with that.
And yesterday there was a session about formative and summative learning. So what we are doing is more important because we are assessing for the learning. So if you teach the student how to answer the question over 3 internal assessments, automatically that's what he will do in university. So your college will do, subsequently other colleges will also start.
So last session for now, MCQs. After that, we'll break for lunch, and then we'll come back to some of our activities. So you can give your answers, and whose answers will be mistakes will be found, will get a chocolate. No? Because questions, there will be mistakes. Yes, it's good, so that we are learning. It's just for learning purposes. So now 10 minutes on multiple choice questions. We need to identify the components of MCQs, describe merits and demerits, frame MCQs, and evaluate an MCQ. These are your learning objectives. Why MCQs? Oh, I already put. No, there are many more coming, so you have to tell me now. Why MCQs? Okay.
Specific answers.
Okay, one is wide coverage. Okay, agreed. Then next,
Specific answers.
specific answers. Then guessing work is
No guess.
less is there, but less questions. Okay, very good. Then any other?
Just the knowledge of the student.
Easy to correct, very important. Easy to correct, very important.
The key answer also, because
Okay.
because going to the system, there is answer key is there. None of the universities is answer key for the longest and shortest.
Okay.
Only MCQ.
MCQ.
Difficult to copy.
Okay. Okay. Difficult to copy, but you have to be careful in one part. What is that? Different codes. Okay, different versions. Yes, yes. Very important. Yes.
Handwriting problems is out.
Okay.
Handwriting issues.
No handwriting issues. Very important. Very important. Very good. Okay. So let us see what we have missed. Reliability. That is a time. Easy to mark. It can be used repeatedly. Yes, nobody has told me. Yes. Saves paper. Good. Wider sampling of subject matter, and very important is your what examination we use MCQs always? Entrance, NEET, next will be MCQ based. So we have to teach students how to answer MCQs. Variety type of questions, large number of questions, broad coverage of concepts, performance of student can be evaluated. It is used in selection for CET. It is used as a teaching aid of learning. Ability to measure higher levels of cognition and ability to discriminate good and poor students. These are your important advantages of MCQs. Yes, I will not go into the next one. You have to tell me the disadvantages of MCQs.
Guessing.
Okay, luck factor.
If there is one outlier, we can easily guess.
Okay, okay. That is framing of MCQs. We'll leave it. Your framing should be proper. Framing of MCQs. So, most difficult part of MCQs is framing of MCQs. You need to have a MCQ bank. If you have a good number of MCQs, it becomes very easy for teaching purposes and for evaluation purposes. Any other disadvantage of MCQs?
We can't assess in depth. We can't assess.
We can.
Actually, yeah, depth of knowledge is
We'll see how it is done. Means MCQ just does not mean ABCD. There are other ways how we can do it. These are multiple choice questions. Easy to? Okay. Disadvantage. Okay, great. Okay. Anything you have left? Advantages, it's okay. So, tedious job to construct, considerable time is spent in pre and post validation. Yes, this validation is a very important point which we are not taken into consideration. So, your juniors will construct the MCQs and the confounding factor HODs will tell, no, remove this MCQ. Yes, it has happened, I think so. But we need to validate it. Validation of MCQs is very much required. Needs adequate resources. So what are the resources you require for MCQs? Okay. References, proper references. Most important thing is proper references. Management of MCQ bank, money, faculty and manpower. And it can't test the power of expression, logical thought or process. Like essay questions and short answer questions, it can assess your logical thought.
Especially sir, references, very difficult.
Very important.
For one subject there will be 2-3 standard books. Okay. Student would have and the answers will be
different in different books.
So I would have referred and both options sometimes it will be there in the options.
That's validation. For that validation is
so which book you will quote or students will.
That is why I told you sometimes those questions are you would have taken so much time to prepare that question and then you will have to cancel the question. So these are your important components. Your stem, your key and your distractors. So keep your stem, key and distractors in ideal way. Let me go into that. So now this is what we are telling, directions to frame MCQs. Design each item to measure an important learning outcome. One learning outcome, don't keep 2 or 3 learning outcomes. Present a single clearly formulated topic in the stem. State the stem of the item briefly in simple and clear language. Make certain that the stem consists of a statement or an idea, not a single word. Place all common elements in the stem of the item. It makes the item compact. We will see examples as we go ahead. Most importantly, the words not or except should be underlined when used in the stem. How many people have done that? And I have seen many questions, even in university sometimes, oh, it was not, it was except, oh, and then they come to know after coming out of the examination hall. Make certain that only the intended answer is correct or clearly the best, as we just now discussed. All the alternatives should be grammatically consistent with the stem and parallel in form. We will see examples to that. Use plausible distractors. Each distractor should be, by its nature and content, be such that it appears to have something to do with the question. So sometimes, many times, 75% of the answers are, it cannot be the answer, so this is the answer. It should not be like that. The answer should be such that you search the answers among the four. Avoid clues that may suggest correct answer or answers to other items. And lastly, the distractor and the correct response should be similar in relative length so as to avoid any clues. So all of the above. Avoid the use of the distractor, all of the above, as much as possible. Many times all of the above becomes very difficult to explain it to the student later.
If you know the two answers, if you don't know
Third one, then
they should give the answer.
Answer is all of the above.
Answer correct, any unanswer correct.
So that is guessing work becomes easier. Be careful while using none of the above also. Avoid double negatives and abbreviations. What are double negatives? Can anybody give me examples of double negatives? Okay, not uncommon. Which of the following is not seen in something like that? Some not uncommon. Okay. An item with numerical alternatives, arrange the alternatives in rank order. Question should be generally structured to ask for the correct answer and not the wrong answer. Just now what we discussed about. And time should be maximum 40 to 60 seconds. So these are the different types of MCQs. You will have to give examples later. Let us see examples. Single best response. So simple completion type, question type, negative form type and case history type. Rubor, in bracket redness in inflammation, is caused by. So this is an easy. It becomes the easiest type of MCQ. Case history analysis. You need to be careful. See, my distractors are also the same length. It is not different length, so that the student gets an idea what is the answer. I will not go into the question proper. This is again simple completion type. The organism that causes syphilis is negative form type. All of the following are signs of shock except. So what is wrong here?
Except is
Yes. So I have told you except should be written in. I have underlined it here. It should be in bold letters. Okay, that depends on you. So this is the most common format. It tests recall of facts. Use of all of the above and none of the above is left to you. Be very careful while using this. And then grammatical clues and length of correct response should be used carefully. Comments on each of these. Which of the following are diuretics? Furosemide, thiazide, mannitol, all of the above. Which is in the first one? What is your comment? Anybody?
All of it.
Okay. I don't want your answer. You are all intelligent. What on the question? What is wrong in the question?
There is a clue R. There is a clue R.
R is not R. So don't use such type of grammatical clues. R. Change the question. Change the question. This type of question don't ask. You better ask all of the following are examples of diuretics except. That is better. Following contrast media is used for IVP except. Again, none of the above, it's better not to use the word none of the above. Easy.
Double negative.
Yes, exactly. Where double negative?
Except and none of the above.
So in the question itself, there are double negatives. Again, and impermeable is an. Becomes very easy to answer. And see that we are given a hint here.
This is point.
Exactly. You need to be careful. We don't do such mistakes usually, but we need to be careful while giving such type of questions. This is your answer to Srinivas, your answer. You are asking, no? Justify. So you can use these type of questions. Multiple completion type. CA service is etiologically associated. If you can tell me your question, what was your question? Rational. Justify, use the word justify, and you can ask questions like this.
That's multiple choice.
Multiple choice, not in short
Short
answers.
answers I was talking.
Difficult. So this is your multiple choice, but again, what is wrong here? All four are correct. Try to avoid that. Tests. So sir was telling, so with this we can test the higher levels of cognition. Can be used with only 4 distractors and reduces bias with the length of the alternatives. True or false type, I don't have to go into this in detail. We can use this, but 50%. Correct. This is your relationship analysis type. Helicobacter pylori is an important etiological agent for peptic ulcer disease. It causes imbalance between gastroduodenal defense mechanisms and damaging forces. Both statements are true, both statements are false. First statement is true, second false. First is false, second is true. But it will take more than 65 seconds probably. So you need to be careful to keep lesser number of questions. These type of questions in a question paper should be lesser number. This is your matching type, what can be used. So these are all the different types of MCQs that we have seen. So assembling an MCQ paper, selection of questions, syllabus, number, time, type, all should be kept in mind. We have to group it properly, proper instructions, preparation of answer sheets. What are the different types of preparations of answer sheets in MCQs? What university used to use earlier was that used to mark what? OMR sheets. But I think so now everything, if it's MCQs, it is on the computer. What is it? Online. They are all online questions now. And you should need a very clear marking methodology. Very important, as I told you, is validation of MCQs. You need to take your colleague into ask him or her whether it is correct or not. Pre-validation of MCQs is done by subject experts before exposing students to MCQs. So how do we do pre-validation of MCQs? We have got the difficulty index, how difficult or easy is the item. Then we have got the facility value and the discrimination index. It can discriminate students who understood subject and who are not. Then you have got effectivity of distractor, any distractor serving purpose effectively. And then purpose of distractor is to distract a naive student from correct answers. So there are many things in validation. Actually there is a mathematical formula. More than 75% of the students get the correct answer, then it is a poor MCQ. Less than 20% of the students get the correct answer, it might be a difficult MCQ or a poorly constructed MCQ. So you need to be careful in that part also. I need your indulgence in this. Negative marking in MCQs, is it good or bad? How many are for good? Please raise your hands. How many are for bad? Please raise your hands. Many more are for bad. So everybody, I don't know. Okay. So I for one, I think so negative marking is required because the number of marks is so less, 100 marks. And if everybody gets a 70, 70, 70, how do you distract? How do you get a, you need a super over. The super over is probably the negative marking.
Especially when there is a ranking system is there, most people will club in that you cannot do the...
It's very difficult. Negative marking is only for
university exam.
No, there is no negative marking. But for CET and NEET, I think so negative marking is very much required. So this is all about MCQs.
Normalization. Though you have got a lesser score, your rank will be better. Depends on the difficulty level.
That is percentile. Percentile.
Validation, exams and all. According to validation, if nobody is questions, that weightage is less. If one question everyone answers, then what is less? Like there's some weightage.
Rank came very high because of the normalization, difficulty level of questions.
This is a new thing that I am hearing.
No, percentile. Even percentile is.
No, sir, percentile is different. That is what madam is telling is weightage. 1 minute. So that's what madam was telling is weightage to each question, especially in IIT and all. No, not about how the difficulty is assessed is, if a question is answered by maximum students, then if almost a question is almost all the students got it right, then it carries low weightage. If a question nobody has answered it, then also it got low weightage.
But it
If question
weightage is more maybe.
No. Weightage is less. If all have answered also less weightage. If none have answered also less weightage. If one question only answered by 25% or 30% student means, then it carries more weightage. Like that.
Normalization according to what
is that? What is called normalization?
To get this ranking. That is
Google said why the JEE main and advanced is a toughest exam in the world. So why is to make the ranking system by making the different level of difficulty questions. So those are, as madam told, there will be more weightage. There will be more weightage for those who answer difficulty question. Otherwise, everybody will be congested in the same group.
But maybe in our
percentage is different.
In our department when we do it, I think so it will be difficult.
Here is not required.
No, it's fine. It's no problem. But we need to, the question should be framed so difficult in our subjects that higher levels of cognition probably. So these were all the checklists which I have already told you. Okay, lastly, what is wrong here? Hemolytic anemia is suggested by, I'm sorry, I want all pathology questions only. What is wrong here? Answer, there are more than 2 answers here which are correct. So it is not probably the right MCQ that has been framed. So this is a mistake here. Treatment of bronchogenic carcinoma, again, we have given such a wide variety of answers is very bad. These type of MCQs need to be avoided. What is wrong here? 100% lifelong goes out of the question. Integrated child development program, I don't know what is the answer. Chandru, what is the answer? You also don't know.
5 years.
5 years, okay.
5 years.
But the answer here, the lifelong should not have been used. What did you achieve in this question? In which of the following does hemolysis play an important role? You have given the answer so easily, you have given the answer here. D is the answer, hemolytic uremic syndrome, so you need to be careful while giving the distractors also.
Because whenever they form questions, whatever the exams, whether it is a medical or an undergraduate or whatever it is, at least more than 50% should be easy. So that is why these type of questions might be there. Like, see, on time if you give a very difficult question, all 10 marks will go. No, at least you should have, you should give. If you want to give 5 questions of this, another 5 which are little.
Sometimes in NEET, madam, they have brought down the percentile so low that it becomes very easy to qualify. The
No, what I am telling is this time might be
sometime
okay
might be
for us,
there.
for evaluation purpose.
So now there is a thing called blueprinting. So in blueprinting you decide how many should be average level, how many should be more and how many should be less, defining ones where achievers will be.
No, that's what, this might be okay, that's what I
Yeah,
meant.
so you need to have questions which are okay also and some which are only for the achievers where they can get the result.
No, why I showed this question is, the framing of this question is wrong. The framing is wrong. Yes, I think we are all, okay, 1 minute, yes.
Sir, Mike.
Maintain the confidentiality is very, very important. You told the validity with the others. Institute requests validation. Other questions okay.
Confidential.
Maintain the confidential is very important. Usually they will like don't think so. They will ask other universities. Your friend or others.
For that, I think we should have a bank. We should form a bank and keep validate
Yeah.
earlier.
That's the basic. You need a bank. Because
I have used MCQs at the end of my lectures. I have used MCQs off learning, mostly for off learning rather than for learning. So after the end of my lectures, I have some 10 MCQs which I tell them and I see that at least this much you know. The must know part I put it as MCQs and finish my class. Thank you very much everybody. Let's break for lunch.
Yes, sir.
help